just around the corner, and with that comes strollers on the sidewalks, mums chatting as they share tips on how to make the latest and greatest baby food, and squeals of laughter from kids in the park. But what if you would love to have kids, have been trying, but just have found that it hasn't worked out yet? Welcome to Revivelife. I'm Naturopathic Dr. Joël, helping you with natural tips for fertility on today's show. Recent stats show that at least 1 in 8 couples wanting to conceive may have fertility concerns. In addition, women are having less children, with the average woman having 1.52 children. The trend for fertility rates has shifted from being highest in women between the ages of 20 to 29 to now being highest among women 30 and over in Canada. Couples are tending to delay starting families, often due to careers. Many factors may be related to why a couple may experience fertility concerns. For fertility health, a delicate balance exists with hormones inside the body and more hormones or chemicals that we are exposed to in the environment. Trends show that since 1938, men's sperm counts have plunged by an average of 50%. PCBs found in baby bottles and water jugs and chlorine compounds that bleach paper resemble the human sex hormone estrogen, which may contribute to infertility. For women, estrogen-like pollutants from the same sources are being linked to breast cancer, endometriosis, and painful inflammation of the uterine lining, which may also contribute to infertility. It only makes sense that if our bodies are exposed to hormones in the environment, that it can upset the delicate hormonal balance needed for optimal fertility. Another factor, stress, can also upset the formula by overstimulating the nervous system and the adrenal gland. The result is an overproduction of hormones, including cortisol and estrogen, leading to estrogen dominance. Secondary symptoms from elevated cortisol may result in sleep difficulties and digestive concerns. Because the backup organ to support the adrenal gland is the thyroid, eventually one may have thyroid imbalance as the body is trying to reset itself. Our Revivelife quiz for you today is, number 1, difficulties in conceiving may be associated with thyroid imbalance. Number 2, zinc is a nutrient that can help fertility in males. And number 3, the highest potential for conception is 3 days before ovulation and the day of ovulation. Our snacks for you today are centered around zinc, which is a nutrient important for both men and for women for conception. Zinc contributes to many aspects of your general health and is involved in the building of 100 different enzymes. It contributes to the quality of immunity, building proteins, eyesight, taste, smell, hair, and skin. It's also linked to the production of testosterone in men and assisting optimal balance of female hormones, resulting in the lessening of PMS symptoms in women. It even boosts the health of prenatal babies as a necessary component of a healthy birth weight. Always check with your healthcare team for your supplement program, as a note of caution is that consuming too much zinc can disrupt absorption of copper and iron, as well as create large amounts of toxic free radicals. The current RDA for zinc is 15 milligrams a day. I couldn't help myself today and had lots of fun creating these snacks for you. So we have 5 actually for today. We have Mediterranean baked oysters with spinach, tomatoes, and balsamic vinaigrette. 6 oysters can provide as much as 76 milligrams of zinc at once, nearly 7 times the recommended daily allowance. A decadent indulgence once in a while. A tip when eating oysters is to take time to chew, as anecdotal evidence suggests that chewing helps release the romantic qualities into the body quicker. Where does this romantic feature come from? Oysters contain dopamine, a neurotransmitter that helps influence brain activity and sexual desire in men and women. Note, make sure you purchase your seafood from a reputable source and ask for wild, eastern, or Pacific choice grade versus standard or commercial grade. Another snack, a handful of pick-me-up pumpkin seeds and cranberries. Pumpkin seeds contain about 6.6 milligrams or 59% of your RDA per cup and are one of the highest concentrations of zinc available in a non-meat food. Watermelon seeds. Did you know that these popular Middle Eastern and East Asian treats can be eaten raw or in a roasted form, which are found in ethnic stores? They can be added to salads, smoothies, or just as a snack on their own. Dried watermelon seeds provide 74% of the RDA per cup. We've got a smoothie. It's called a Zinkalicious Watermelon Frosty. And this one, again, packs the body with wonderful source of zinc. And lastly, we've got watermelon sticks. What could be simpler? Don't forget to always check with your healthcare team for your supplement program, and we want to make sure that everything works in balance. We've got a lot more coming up on fertility for you today, so don't go away. Back to Revivelife and our show on fertility. Earlier, we were speaking about the zinc-rich snacks to balance hormones. Other top zinc-rich foods include nuts and seeds. Why stop at just pumpkin seeds or watermelon seeds? As all nuts and seeds, including almonds, peanuts, pine nuts, cashews, and sunflower seeds, work well too. Toasted wheat germ, which can also be found in jars or sold toasted, and wheat germ is great to sprinkle on top of any kind of food. Try it on salads, rice, or steamed vegetables. A quarter of a cup of toasted wheat germ provides 32% of your recommended daily allowance. And who doesn't love dark chocolate and cocoa powder? 50 grams of unsweetened baking chocolate gives you 32% of your RDA. Indulge and feel great. Lastly, meat is all rich in iron. Be sure and choose lean sources, though, of beef or lamb, and not necessarily a meat, but shellfish such as crab, lobsters, clam, and mussel are some of the most powerful natural sources of zinc a person can eat. In addition, whole grains, try brown rice and bran. Our next guest is an obstetrician and gynecologist with a specialization in reproductive endocrinology and infertility. She's currently an assistant professor of obstetrics and gynecology at the University of Ottawa, an attending physician at the Ottawa Hospital, and a full-time consultant physician at the Ottawa Fertility Centre. She's also certified by the American Registry of Diagnostic Medical Sonographers in obstetrical and gynecological ultrasound. We can see that with this comprehensive training, she has a passion for helping couples conceive. Not only that, but her approach includes optimizing health through lifestyle, exercise, and nutrition, as that's the way she lives her life. Welcome, Dr. Tannys Vause.
Thank you for having me.
We were just chatting a lot about, a little bit about what introduced you to this whole area. And so why did you become interested in fertility?
Well, I first became interested in this area while I was doing my training in obstetrics and gynecology, and I found that it was a very fulfilling area and that you're working with a lot of young couples and helping them pursue their dream of having a family.
Must be very exciting when you're able to help somebody to actually conceive.
It is.
Yeah.
It definitely is.
And so for those people who are sitting at home thinking it's springtime and maybe, we should start thinking about it, what are the common causes if people are having fertility issues?
Well, there's a lot of different causes to infertility, and there's a few core things that you need in order to conceive. One of the most important factors is whether a woman is ovulating or not, or releasing an egg each month. And most commonly, women can know if they're doing this by the fact that they have regular menstrual cycles. So if they're able to have a menstrual cycle each month, likely they're releasing an egg, allowing them a chance to conceive. Other important areas would be mechanical issues, so whether their fallopian tubes are open, if they've had a previous pelvic infection, or if they have a known history of endometriosis or a tubal or ectopic pregnancy. Those could be important factors that could interfere with getting pregnant. And the other important area is also the male contribution.
Sure, yes.
And as to, exactly, as to whether they have a normal sperm count.
Okay, so with all of that being said, a lot of times people might not know that any of those issues exist.
Exactly.
They start trying to conceive, and then when should they start thinking that perhaps they should get some help?
So for most couples, we suggest that they try for about 12 months without contraception, and if they're still not pregnant after that time, then they should start seeking some fertility evaluation. However, in women that are a little bit older, so women that are older than the age of 35, we recommend seeking out fertility evaluation after about 6 months of trying, just to sort of speed things along,
That's very
just in
helpful.
case there's an issue.
Yes, exactly. Because I think there's a presumption that people think, I'm just going to decide that we're going to become pregnant and then it's just going to happen.
Exactly.
So this, of course, is why the Fertility Center is there. So the Ottawa Fertility Center, what does it offer? And if somebody was calling for an appointment, what should they expect?
Okay. The Ottawa Fertility Center is a comprehensive fertility center that offers many different fertility services. And basically, when a woman calls or comes in for a consultation, the first thing she would do is meet with one of the physicians at the clinic to do a thorough history and physical examination to try and see if there's a reason as to why her and her partner have not yet achieved a pregnancy. Based on the history and physical examination, her and her partner will be sent for some initial fertility evaluation to see if we can, again, tease out a reason why they're having difficulty getting pregnant.
Okay, and then would their family practitioner still fit into the picture? Do you need a referral?
We do, yes. So in order for a woman and her partner to be seen at our clinic and have their consultation covered by OHIP, she would need a referral from her family physician or any other physician in order to be seen.
Okay. When they actually are assessed then, what type of labs are really important to consider?
So the most important labs that we do for most couples who present for fertility evaluation are labs looking at whether a woman is ovulating, what her ovarian reserve is, or how well her ovaries are functioning. We examine their thyroid function to make sure that it's in balance, as well as check other hormones like prolactin or potentially male hormones if they have certain signs and symptoms of a male hormone excess.
What would be a sign that a woman might have male hormone excess?
So some women may complain of symptoms like acne or something called hirsutism or excess hair growth.
Sure. So perhaps a little bit male pattern, like the mustache
Exactly.
or the acne around the jawline or something like that. Okay.
Exactly.
Yeah,
in addition, other women
factors.
who have symptoms of polycystic ovary syndrome, which often comes along with very irregular periods, and also concerns with excess hair or acne. We would send for those evaluations.
Because a lot of times the women could be taking the birth control pill and these symptoms can be masked.
Correct.
And then all of a sudden they decide they want to become pregnant and stop the pill.
Yeah.
And then all of a sudden there's different things that happen.
Exactly.
Yeah. Okay, so when a person gets evaluated, then there's always that question, cost. How does it work out in Ontario?
So in Ontario, if you're a resident of Ontario and covered by OHIP, almost all of the fertility evaluations are covered by OHIP, including your initial consultation, as well as your initial fertility testing, including both blood work and ultrasound examinations that are required.
Okay,
there are
that's good to know.
some tests that occasionally do incur a cost for the patient, and we would obviously discuss that with them before sending them for that test. But the majority of it is covered.
Okay. Now, if they need care, so let's say that they've gone through all this panel of testing and then the physical obstruction is ruled out, but they're still not becoming pregnant and they need some assistance. There's all these IVs, and we'll maybe get into one or two of them and then finish them up at the latter part of the show. But of course, the IVF is the most common word that we hear.
Right.
What exactly is that?
So IVF stands for in vitro fertilization, and this is basically a test tube baby. So a woman goes through fertility or ovarian stimulation through injectable fertility medications to try and encourage her ovaries to make many egg follicles at one time. We then remove the egg follicles from her body and mix those eggs with the partner's sperm to create embryos, and those embryos are grown in our lab for a few days and then replaced back into the woman's uterus to hopefully lead to an ongoing pregnancy.
Okay. It's amazing that we have this technology and the ability to do this. We're going to talk more about all the different techniques and natural treatments, so thank you so much, and we'll be back. So as we head into our break, what other common vitamin deficiency may lead to an increased risk of fertility?